17 Cancer symptoms you shouldn't ignore. Many of us have postponed the annual tests and checkups where tumors are frequently identified in an effort to protect ourselves from coronavirus. It makes sense that way. However, one of the finest tools in the fight against the disease is early detection. Screenings can find cancers before they cause symptoms. By closely observing changes in your body, you can spot early warning signs on your own. Contact your healthcare physician if you discover anything new or different that persists for a few weeks, and a few weeks is important. Not all cancer symptoms are indeed cancer, but these 17 signs can make you want to call your doctor. 1. Irregular menstruation or pelvic pain. Most women occasionally experience cramps or an irregular period. However, prolonged pain or changes in your menstrual cycle may be indicators of ovarian, uterine, or cervical cancer. 2. Changes in bathroom patterns. Among other cancers, significant changes in physiological functioning might be a sign of bladder, prostate, or colon cancer. Constipation or diarrhea that doesn't go away, blood in the urine, black, tarry stools, blood in the stool, or red or black blood in the stool are all warning symptoms. 3. Bloating. We've all experienced occasional bloating. However, bloating that lasts longer than 2 weeks may indicate ovarian cancer as well as other gastrointestinal cancers. 4. Breast changes. A new lump, dimpling, discoloration, changes in the area surrounding the nipple, or an odd discharge that you didn't have before are examples of these. Men can also get breast cancer, despite the fact that women typically do. 5. Recurring cough. A cough that lasts longer than 2 weeks, especially one that is dry, may indicate lung cancer. 6. Persistent headache. A brain tumor may be the source of a headache that persists for longer than 2 weeks and is unresponsive to standard treatments. 7. Having trouble swallowing. It may indicate stomach, lung, or throat cancer if you experience difficulty swallowing for longer than 2 weeks or feel as though food is becoming trapped in your throat. 8. A lot of bruising. It's typical to sustain a shin bruising from slamming against the coffee table. But suddenly developing numerous bruises in strange locations where you haven't been hit can be a sign of several blood malignancies. 9. Frequent infections or fevers. It can be a sign that lymphoma or leukemia has compromised your immune system if you keep getting fevers or have recurrent infections. 10. Oral changes. Particularly in smokers and heavy drinkers, persistent sores, lesions, or painful mouth areas may be signs of several oral malignancies. 11. Skin changes. A medical professional should evaluate any change in a mole or birthmark, either in person or via video visit. Use this simple mnemonic, ABCDE, to help you recall which changes to be concerned about. Asymmetry. A mole or blemish that has one half that differs from the other. Border. The borders are jagged or fuzzy. Both black and brown are uneven in terms of color. It has a diameter that is greater than a pencil eraser. Any mole that bleeds, develops, or otherwise alters over time is considered to be evolving. 12. Pain that lasts. Anywhere in your body, chronic pain that is unresponsive to conventional treatments and has no apparent explanation should be evaluated. 13. Persistent tiredness. No matter how much sleep you've been receiving, a sudden, significant change in your energy level could be an indication of lymphoma or leukemia. 14. Postmenopausal bleeding. There are several causes for this, but if it continues, your doctor might want to examine you for uterine or cervical cancer. 15. Nausea or stomach pain. Unusual discomfort that persists for longer than 2 weeks may be an indication of malignancies of the liver, pancreas, or different parts of the digestive system. 16. Weight changes. Weight changes. Gaining weight without trying or losing appetite can be signs of a variety of malignancies, particularly those that have spread. 17. Abnormal lumps. Any new tumor or lump that persists should be examined. When you have a cold, your lymph nodes frequently swell, but if the swelling continues after you feel better, you should see a doctor. Thank you for watching. Subscribe to my channel if you haven't already, for more health-related contents. Bye.